So, today's topic is lungs. What are lungs? Lungs are basically the viscera that are lying in the thoracic cavity. So, here in this picture, we can see that this is the thoracic cavity that is bounded in front by the sternum, on the sides by the ribs, and posteriorly we have the vertebra, the thoracic vertebra. This blue structure that we are seeing on either side of the mediastinum are the two lungs. Lungs are the respiratory organs. In this picture, this white outline is for the ribs, and in between the ribs, this bluish outline is for the lungs. We have two lungs, the right lung and the left lung. The difference between the two lungs, one of the differences between the two lungs is that the left lung has this notch for the heart that is called the cardiac notch. Now, the general features of the lungs are such that it has an apex at the top, a base here, various borders, the anterior border and the posterior border, various surfaces. This the costal surface and the medial side has the mediastinal surface. Lung is further subdivided into various lobes and fissures. In this picture, we can very well see that the different colored lobes in the right lung has three lobes, this green one, this yellow one, and this red one. And this left lung has two lobes, this blue one and this purple one. So the right lung has two fissures which are dividing it into three lobes, and the left lung has one fissure which is dividing it into two lobes. The various surfaces of the lungs are the costal surfaces. Costal is from the ribs that are surrounding the thoracic cavity and the lungs. So this anterior surface is the costal surface. Then is the diaphragmatic surface that is lying on that is on the base. This is the base of the lung. The lungs are lying on top of the diaphragm. So this inferior surface is the diaphragmatic surface, and the medial surface of the two lungs is called the mediastinal surface. In this picture, we can see the mediastinal surface of the lungs. Now, the mediastinal surface has two parts. This central structure is the root of the lung. So, the part anterior to the root is the mediastinal surface, and the part posterior to the root of the lung is called the vertebral surface, as this part is close to the vertebral column. The borders of the lungs are this sharp one is the anterior border, this rounded one is the posterior border. So in this view, we can clearly see this anterior border is sharp and this posterior border is rounded, and the inferior border is the on the base. Now, what is root of the lung? Root of the lung is on the mediastinal or medial surface of the lungs, the two lungs. It is the area at which various structures are going in or coming out of the lungs. These are the pulmonary arteries, pulmonary veins, the bronchi, the principal bronchus, various bronchial arteries, veins, and the lymphatics. Now, the differences between the two lungs are these differences, the shorter and the broader, larger and heavier, are minor differences. The main difference is that the right lung has anterior straight border and the left lung has the cardiac notch, as I've mentioned before. In addition, the cardiac compression on the right lung is very shallow or absent, and it is very deep on the left lung. The right lung has no lingula and the left lung has an outward projection just below the cardiac notch that is called the lingula. It has two fissures and dividing it into three lobes. The left lung has one fissure and hence two lobes. Now the arrangement of structures at the root of the lung is important. Here we can see this boundary is called the pulmonary ligament, as I have mentioned in my lecture on pleura, that the pulmonary ligament is the area where the parietal pleura and the visceral pleura meet at the root of the lung. This magenta lining is the pulmonary ligament. The structures in the right root are the eparterial bronchus and the hyparterial bronchus, then the pulmonary artery, the two pulmonary veins, the lymphatics, bronchial vessels, and the pulmonary plexus. In the left lung, we have one pulmonary artery, two pulmonary veins, bronchus, a principal bronchus. In addition, we have the pulmonary plexus of nerves and the bronchial vessels. Now, the various impressions on the mediastinal surface of right lung are, in this picture, we can very clearly see that this structure, this is the esophagus posteriorly. Then just in front of the esophagus, we have an impression for the trachea. On top of it is the impression for right vagus nerve. Anterior to it is the right phrenic nerve. Then this is the right brachiocephalic vein, superior vena cava. Slight impression of the ascending aorta. Then we have the impression for the right atrium and right ventricle thoraca. And then we have the inferior vena cava impression. And here we can see that this is the pulmonary ligament. Now the various impressions on the left lung are posteriorly we have this thoracic duct, esophagus, and the left recurrent laryngeal nerve. Then anterior to this, we have the left subclavian artery and the left common carotid artery, this arch of aorta and the descending aorta, this portion of esophagus, and here we have the pulmonary trunk. These impressions are important. Now we'll slightly discuss the bronchopulmonary segments. So what are the bronchopulmonary segments? These are the anatomic, functional, and surgical sections of the lung, and they are very important. If the lung is a part of the lung is diseased, the surgeon can take out a segment very easily as they have their own blood supply, nerve supply, and lymphatics. So the various segments are in the right lung, we have the apical, the anterior, and the posterior segment. In the middle lobe, we have the medial and the lateral segment, and in the lower lobe, we have the superior, anterior basal, lateral basal, posterior basal, and the medial basal is on the posterior surface. This is the right lung posterior surface, and this is the right lung anterior surface. So on anterior surface, we cannot see the medial basal, that is only visible on the posterior surface of the right lung. Now the segments of the left lung are the apical, anterior, posterior, superior, medial basal, lateral basal, superior, posterior basal, and the medial basal is only visible on the posterior surface of the left lung, just like the right lung. So these are the segments of the lung, and they are very important surgically. Here we can see that each segment has its own bronchiole, its own branch of pulmonary artery, its own bronchial artery and bronchial vein, and a segmental arteriole. One thing that is not individually present in a segment is the vein that is in the intersegmental part. These are the two segments, and the intersegmental part has the vein. So these segments are surgically very important, as a diseased segment can be easily removed without disturbing the structure of the remaining lung. Tracheobronchial tree is such that the trachea divides into bronchi, the principal bronchi, which further divide into bronchioles. This is the bronchus, which further divides into segmental bronchi. They further divide into terminal bronchioles. The diameter of the terminal bronchioles decrease, and it becomes a respiratory bronchiole. The respiratory bronchiole enters into alveolar ducts. The alveolar ducts then open into tubular sacs that are called the alveolar sacs, and each alveolar sac has outpouchings that are called the alveoli, which are grape-like bundles, and where gaseous exchange takes place. Each alveoli is surrounded by capillaries. The air inside the alveoli exchanges with the blood in the capillaries that are surrounding the alveoli. So here gaseous exchange takes place. The lungs are supplied by pulmonary arteries and bronchial arteries. The bronchial arteries are one on the right side and two on the left side, and the bronchial arteries are branches of descending aorta. The veins, bronchial veins, they drain into the azygous veins. Nerve supply of the lungs is by the pulmonary plexus, which is partly formed by the vagi, and lymphatic drainage is through the tracheobronchial lymph nodes. That's all for today. If you have any queries, please ask.